I'll talk to you again tomorrow. Hi, I'm Dr. Paul. I want to talk about surgery today. And, and the reason I want to talk about that, and it seems like, why in the world am I talking about chronic pain and surgery? A lot of the people that we saw with, with fibromyalgia, CRPS, trigeminal neuralgia, it was set off by a surgery. And I have nothing against surgeons. I love surgeons. They're awesome. They're like high tech. They do wonderful things and they help so many people. But if you're a surgeon or an anesthesiologist, maybe you can look at this. I believe that the positioning of the neck, maybe the support under the neck, the lack of ability to move for long periods of time under anesthesia is one of the things that contributes to these problems. And the reason I've seen that is just because I've seen it over and over so many times, and not by any fault at all by the doctor or the anesthesiologist, but I had a woman, she woke up screaming after her hysterectomy uncontrollably. She ended up on morphine and in a wheelchair and taught school from her wheelchair. Well, she came in to see me, and in 2 months we had her off of her morphine. I didn't take her personally. I have a psychiatrist in the office that works with people like that. And she was off her morphine. She was out of pain. She went home pain-free and back to a normal life. I've seen many other people. So we did a study. Here's the bottom line. We did a study, and the study was this. If you had fibromyalgia, and we used those patients, and you had a surgery to correct something that you were in pain with while you had fibromyalgia, what was the outcome? And so what we found on 74 patients, that 65% of them got worse instead of better after the surgery. And I thought, well, that's really interesting. Didn't really anticipate that. 2 got better out of 74, which I thought, well, that's really shocking. And then there were 3 that had multiple surgeries. 1 got better, 1 got worse. So overall, even if you count the 3, there was only 5 out of 74 that got better. And so what this shows me is that people with a diagnosis of fibromyalgia, we need to take care of the fibromyalgia first and get rid of the symptoms. So if you're a fibromyalgia patient, you might want to take a look at what we're doing first before you have a surgery. If it's still there, we recommend you go back to the surgeon and follow his advice. So thank you for listening. Please like and share this. We're trying so hard to get it out. Thank you so much.